Good afternoon, everybody, and thank you so much for joining us for another one of our fabulous Meet the Specialist sessions. We know that these are in high demand and people are really liking them, so we're going to keep doing them. And today we are joined by the very lovely Mr. David Evans, who is a clinical psychologist who works with both adults and adolescents. I'm going to hand you over for him to give a bit of discussion about himself, what he does, what his areas of expertise and interest are, so that you get an idea of what he brings to our expert panel, and hopefully you will look to be booking with him in the future. So I'll ask if everybody could remain on mute while the session is in progress. And then at the end of the session, if you have any questions, you can unmute yourself and ask away. So again, thank you so much, David, for joining us, and over to you.
No, thank you for having me. Also, please don't mind my voice. I'm coming off a horrible cold, so I've still somewhat lost it. So if you have any trouble hearing me, please let me know. If you think I'm mouthing something at you, I'm probably trying to say something. But thank you for the lovely introduction. So yeah, my name is David Evans. I'm a clinical psychologist in Adelaide. My background, so I actually studied law and psychology at Flinders University many years ago. Wasn't sure which one I wanted to do, to be quite frank, at the time, and started doing lots of work experience in both. And I enjoyed the law, but I definitely found that psychology was my calling. Fast forward, did postgraduate in Sydney. I got my clinical masters, came back to South Australia. And I work privately across a couple of different places doing therapy with adults and adolescents, and also medico-legal assessments. I've also recently completed my GDLP finally, which is nice to have off the bucket list. Yeah, look, there's really not much to say about me. I enjoy working therapeutic with adults and adolescents. I believe in holistic formulations and the scientific method. I've done a lot of extra study in forensic psychology as well as neuropsychology. I really feel that understanding all the different variables at play helps to actually understand someone. I think that's reflected in the nuance in quality of the answers that go back to the courtroom. I'm also a big fan, I don't know if that's the right word, but I'm also a big believer, for a better word, in understanding what's a question of law, what's a question of science, understanding, well, going through that scientist practitioner stage of observation, hypothesis testing, and making sure that I answer questions in a scientifically meaningful way that also has relevance back to the law, and trying to do that in a transparent process. That's really me, to be honest. I'm actually a pretty simple chap at the end of it all. Does anyone have any questions about anything to do with any of those areas?
I have one, David, from somebody who's unable to attend today,
Yeah.
and that is in relation to your focus on behavioural psychology, but also your qualifications in the law. So particularly in relation to workers' compensation matters, where there is a claimed psychological injury in relation to, for example, workplace bullying and harassment.
Yep.
How do you go about balancing those kinds of claims with the letter of the law in relation to matters being treated and resolved in the workplace?
I guess there's a few different layers to that. On one hand, in terms of an assessment, I think it's having a good question to begin with. So, what is the question, and can I even answer it? And if so, to what extent I can. And I think in terms of anything to do with workplace injury, workers' compensation, or the criminal, anything really to do with medical legal, I think there needs to be a big focus on having a good file review and also understanding both the validity and reliability of your evidence. And those are terms that we use in sciences. But basically, is there anything that's getting in the way of me being able to trust this source of evidence? And a big part of that is, again, the file review, to look for inconsistencies, but also psychometrics. So there's tools such as the PAI, the MMPI, And more recently, there's the IOP, the Inventory of Problems, which is really good because it's much quicker. That helps sort of look at feigning mental illness. And with the neuropsychology, again, there is maybe a head injury involved. There's also malingering checks, such as the TOM, that can be put into place, which are really effective. But I think with any sort of workplace dispute, it's understanding that there's always multiple sides to the story. It's understanding the nuance of it, and that it's not going to be black and white. And it's acknowledging that is like, well, again, what's the question? How can I make this into a question that I can actually answer using scientific method? So that on one hand, I'm doing my job to the best of my ability, but also I'm actually informing the law, informing the courts, because really that's the main thing that I'm trying to do.
Yeah,
I
absolutely.
don't know if that's answered your question.
That was, well, the person hopefully will listen to this after the fact. They're actually an insurer's case manager who asked me that question. Does anyone here have a question that they would like to ask of Mr. Evans? You can unmute yourself and pose your question, or if you don't want to speak out, you can type it into the chat. Okay, good. Well, I do want to ask you another one while I've got you there. So, what are the favorite, if you can use favorite is a loose term, what are your favorite types of matters to do if someone approaches you with a medico-legal? What are the ones you really enjoy doing the most, and what are the ones you know that you think you really shine at?
Yeah, look, I enjoy anything to do with capacity assessments. I very much enjoy doing neuropsychological assessments. So testamentary capacity, fitness to plead in criminal cases is always something that I really enjoy doing. Oh,
Did you see what I did?
yeah. A second.
Hang on a sec. Let me see. Annette, were you wanting to ask a question then? Oops, not. I'll just mute her. I'm sorry. Please continue, David.
That's right. So I guess anything around capacity. I think anything in regards to the criminal law. I enjoy doing things regarding workers' compensation, especially assessments. Yeah, I think that would pretty much cover me, to be honest. I also enjoy doing immigration matters.
Okay.
So,
And is that in relation to refugee status or humanitarian ones, or are they normal migration ones, such as parenting, spouse and family?
more to do with capacity in terms of, can this person sort of go through the regular process, or maybe they can sort of skip parts.
Okay. So
And
that would be persons seeking to migrate who have a mental health condition?
yes, yeah. And again, I think it's really interesting area because on one hand, there's the questions of law that are at play. Can they undergo certain functions? And on one hand, there's the neuropsychological tests, and there's obviously the clinical pathology type aspects. And sort of like, well, how can I formulate these things? How can I test these things? How can I answer these things and meaningfully apply them?
Yeah, and you often be working with an interpreter in those matters. Am I right?
Yes. Makes it a very crowded room. Lots of people have lots of things to say at once, but that can sort of add to the fun of it sometimes as well.
Right.
So,
Wow,
I mean,
really interesting. How, in terms of adolescent, how young of a person would you do an assessment for?
for an assessment, probably 16, 17. For therapy, I go younger. But just given some of the issues that can come up in assessment, I prefer to deal with people a little bit older, just because at a certain point, I feel that I think you need someone who's coming from a very strong family systems background. And the reason I say that is because whenever you're looking at a young person, especially a young person living at home, you can't ignore the ecology of the family environment and what's going on. And
Fair enough.
I think
Yeah.
there are people who are very skilled in that, and I think that's where they shine.
Yeah, absolutely. Well, it's nice to see somebody who can recognize those sorts of things and who doesn't want to take on matters that are perhaps a little outside of their scope. And that's really appreciative to see.
Oh, no, definitely not.
Yeah, no, that's lovely. All right. If no one else has any further questions, I will wrap this up. These are meant to be short little vignettes so that you get to see who our specialist is, what he or she sounds like when they have a chat, or they, and as a means of really getting to know our expert panel of wonderful people.
Well, thank you so much for having me, Michelle. It's really appreciated.
Welcome. And thanks everybody for joining us today. Please join us for our next session. This one will be available up on our YouTube channel within about a day or so you and your people can watch that again to get to know this doctor and have confidence in making a choice to book with Mr. David Evans. Thank you so much, everyone. Have a great rest of the day.
Thank you.
See you, David.